This week we're going to dive into learning the tips, tricks, and tools of community engagement. We're going to start with a quick review of the engagement environment in healthcare. Then we'll touch on the benefits of engagement and get to the how-to part of this part of the program. So, the Health Council in Canada Primer on Public Involvement in 2006 confirmed there's been relatively limited activity within the public environment toolbox that's used by the Canadian healthcare system. Health policy and decision makers have traditionally relied on conventional methods of public communication and consultation to involve the public. They've undertaken things such as information campaigns, public hearings, focus groups, maybe public opinion polls, referenda, elections to local and regional boards. While these traditional methods appear to resonate within the comfort level of healthcare organizations, they report that while implementing these methods, they're faced with several difficulties, such as challenges in mobilizing the public, political interference in the processes, difficulties in dealing with very tight deadlines, complex and emotional policy issues, lack of resources, and creating expectations that can't be fulfilled. So when we start to look at the benefits of engagement, we really want to see kind of what those benefits are before we go out and engage our community. Well, you can use it to build the public's values and interests into your decisions. Engagement encourages meaningful input, where people feel connected and valued. It can help you more clearly define the problem or opportunity. Perhaps there's a totally different way at looking at an issue through an approach that's different to the traditional practice in your organization. You can share ideas and concerns. More people can help shoulder the challenges and provide effective input. When you take your challenges further afield, you need to be able to articulate them differently. The process can force you to develop clearer, more understandable information. Similarly, the decision process is better defined. Instead of forming camps around an issue, it's easier to find common ground. When you understand the various thoughts, ideas, expectations, and challenges, you can better create a clear and understandable rationale for the decision. But most important of all, you will make better decisions. So how can we go about effectively engaging the public? We'll start with a look at the various levels of public involvement. In her seminal article, Sherry Arnstein in 1969 developed a topology distinguishing 8 levels of public involvement. Referred to as the ladder of citizen participation, this topology illustrates that public involvement can vary greatly depending on the role and power of citizens in the decision-making process. So at the very bottom of the ladder is manipulation. Dare I say that this may have been where the people were feeling they were sitting in that photo that I showed last week of the folks that were at the hospital budget cuts meeting. The next rung on the ladder is another form of non-participation, therapy. Then we get to a level that's referred to as tokenism within engagement circles. This is still one-way communication. It's informing. Consultation is next. And then placation. It's like we're meeting to make them feel like they were heard. Then we finally start to get into roles where citizens are truly empowered through partnership, through delegate power, and finally with citizen control. Now there are a few different ways this ladder of participation has been put into action. We're going to work from the spectrum of public participation that's presented by the International Association for Public Participation. I'll introduce that shortly. But first, I'd like to touch on the 3 broad stroke levels of involvement. In public communication, information is disseminated from the source to the public. The flow of information is unidirectional, and there's no authentic public involvement since the source does not seek to get feedback or public input into the decision-making process. There are many different forms of engagement happening in this photo. The public communication form would involve the woman reading on the information boards in the back. In public consultation, the source asks for public input on a specific issue. Prior to the public consultation, the source usually provides information to the public. However, the flow of information is mainly one way during the consultation, from the public to the source. Although some may argue that this is a limited two-way relationship, since the source provides information beforehand and then seeks feedback. But there's no formal dialogue or interaction between the source and the public. Public consultation is mainly used to elicit the raw opinions of the public. In this photo on the far right, the people sitting down are providing input directly to recorders. This is public consultation in action. And then in public participation, the flow of information in interactions is bidirectional. It means information is exchanged between members of the public and the source. There's some degree of dialogue and deliberation in the process that takes place. It's usually in a group setting, which may involve representatives of both parties in different proportions, depending on the public participation method. The act of dialogue and deliberation helps to transform the raw opinions of both parties into informed and enlightened judgments. In this example, it's the engagement of the people who are standing and who are speaking to one another that shows direct public participation. So let's get into community engagement, shall we? When you're planning an engagement activity, you never have to feel alone. The Change Foundation, working with the Ontario Hospital Association, the local health integration networks, the Ontario Association for Community Care Access Centres, and many more partners, created an online toolkit in 2008 and 2009 called Epic Ontario. It's located at www.epicontario.ca. On this site, you can find plenty of information about planning community engagement activities. So Epic Ontario is a resource that was created by healthcare professionals in Ontario for healthcare professionals. It also translates what engagement is for the specific healthcare community. Engagement is the active involvement of people in any decisions that may affect the health of them, their families, and the communities they're linked to. Engagement assumes community engagement will aim to give equal status to lay people in decision making and take seriously lay knowledge and expertise.